What is a urinary tract infection? A UTI is an infection of any part of the urinary tract, the urethra, bladder, ureters, and kidneys. The urinary tract is the part of your body that removes waste from the body via urine. Your kidneys remove waste from your blood and make urine. Ureters transport urine from the kidneys to the bladder, which stores your urine until you are ready to use the bathroom. Your urethra carries urine from the bladder to the outside of the body. You can get a UTI when germs called bacteria enter your urinary tract through your urethra. Signs and symptoms of urinary tract infections, UTIs. Symptoms of a UTI most commonly include painful urination, frequent urination, inability to start urinating, a sudden need to urinate, blood in the urine. Your symptoms will vary depending on the part of the infected urinary tract. For example, if your UTI has infected the kidneys, you may experience back or side pain, high fever, shaking and chills, nausea, vomiting. If your UTI is left untreated, you may suffer one or more of the following complications: repeated urinary tract infections, permanent kidney damage, increased risk of pregnancy complications, narrowing of the urethra, sepsis, a potentially life-threatening infection of the blood. Causes of urinary tract infections, UTIs. A UTI can occur when bacteria enter and multiply in the urinary tract, usually through the urethra. Several risk factors can increase the risk of bacteria entering your urinary tract. Female anatomy: women are more likely to get urinary tract infections than men because, on average, they have a shorter urethra. This shortens the distance bacteria must travel to enter the urinary tract. Sexual activity: sexually active women are at higher risk for UTIs than women who are not sexually active. Certain types of birth control: women who use diaphragms or spermicidal contraceptives are more likely to get UTIs than women who do not. Blockages in the urinary tract: kidney stones or an enlarged prostate can hold urine in the bladder, increasing the risk for UTIs. A weak immune system: diabetes and other conditions that weaken the immune system increase the likelihood of UTIs. Use of a catheter: some people cannot urinate on their own and need a catheter to help them urinate. This includes people who are hospitalized, people with neurological problems, and people with paralysis. People with a catheter are at increased risk for UTI. Diagnostic tests. Your UTI can be diagnosed with a urine test. If you have symptoms of UTI, your doctor will take a urine sample to test for bacteria and other signs of infection. For this urine test, your doctor will ask you to give the sample in the bathroom of the doctor's office, and it will be done as a clean collection sample. This means you will need to use cleaning wipes before collecting a midstream urine sample. This test is sufficient for most uncomplicated urinary tract infections, as most cases of urinary tract infections are caused by E. coli bacteria. In some people, example brands, diabetics, immunosuppressed individuals, and pregnant women, the physician may also perform a urine culture. This does not require an additional sample. This is a test to determine which bacteria are growing and whether your doctor suspects that bacteria other than E. coli are growing. Treatments. How do you cure a urinary tract infection? UTI treatment consists of antibiotics that you take orally at home. If you have an uncomplicated UTI, that is all that is needed. If you have a complicated or severe UTI, your doctor will discuss with you what additional treatments may be needed, such as hospitalization or giving antibiotics through a catheter. There are also ways to relieve your symptoms while the antibiotics clear your infection. Drink plenty of water. Water helps dilute your urine and flush bacteria from your urinary tract. Avoid drinks that can irritate your bladder. Avoid coffee, alcohol, and soft drinks that contain citrus juice or caffeine. These drinks can irritate the bladder and increase your urge to urinate. Use a heating pad. Place a warm, but not hot, heating pad on your abdomen to relieve bladder discomfort. Follow-up tests are usually not needed for an uncomplicated UTI. If your symptoms do not improve after taking antibiotics, you should go to your doctor's office for further evaluation. For some people, such as pregnant women, it is important to come in for scheduled follow-up visits to be retested. Next steps, prevention. How can you prevent urinary tract infections? Here are some ways you can do just that. Drink plenty of fluids, especially water, to flush bacteria from your body. Drink cranberry juice. There is some evidence that cranberry products may have infection-fighting properties, although the studies on this are inconclusive. For most people, drinking cranberry juice for urinary tract infections does no harm. Wipe yourself from front to back after using the toilet to avoid transferring bacteria from the anus to the vagina and urethra. Empty your bladder soon after intercourse to flush out bacteria. Avoid feminine products such as douches, deodorant sprays, and powders because they can irritate your urethra. Consider changing your birth control method if you use diaphragms or spermicidal contraceptives, as they can increase your risk for UTI. When to see your doctor. Talk to your doctor if you feel you may have UTI symptoms. If you have frequent urinary tract infections or a chronic kidney infection, you may be referred to a doctor who specializes in diseases of the urinary tract, urologist, or kidney disease, nephrologist, for an evaluation.